Good morning, thank you for joining us and welcome to this EEF webinar in partnership with Westfield Health. We have a great session this morning with insight, analysis and best practice from our recent report on the role of health and wellbeing in manufacturing. I'm Jenny and I'll be your moderator for the day. Before we get started, I'd just like to draw your attention to a couple of points. This webinar is being recorded. In the next 24 hours or so, we'll send a link so you can review the full webinar at any time. There are quite a few of us online today and we are keen that you can interact with us as much as possible. Your audio line is muted, but we do have a series of interactive polling questions that we'd like to get your response on, and I'd encourage you to respond so you get the most out of the session. When you see the voting questions on your screen, simply select and submit your answer. We also have some time allocated at the end for questions. Please submit your answer in the chat box and we'll put them to the speakers at the end. I'm delighted to introduce our speakers. Dan Lucy, Principal Research Fellow at the Institute for Employment Studies. IES led on the research for the report, and Dan will be providing an overview of the findings and giving the inside track on what they mean for manufacturing. Dan has extensive experience in research and consulting on health and wellbeing at work and in manufacturing. His previous work has included demonstrating how improved line manager performance leads to increased productivity with a leading UK food manufacturing business. James Brown, Health Management Lead at Siemens, will be bringing it all to life and sharing his experience of setting up and managing a health and wellbeing programme. James has been with Siemens for 7 years and is focused on the delivery of their occupational health and wellbeing services. We also have Richard Holmes, Director of Wellbeing at Westfield Health. Westfield Health are a long-standing and valued partner of EEF, providing health and wellbeing services to our members through our EEF Advantages programme. Richard will be taking a look into how employers can support the mental health of their workforce. Richard has worked in workplace wellbeing for 25 years, including in industry and with wellbeing service providers. He has a master's degree in medical science, where he focused on psychology and people's perceived abilities to cope with pressure. I'm pleased now to hand over to Dan to introduce the findings from the report.
Good morning, everyone. I guess the background to this research is the flatlining productivity in the UK since the recession in 2008. EEF had done some previous work looking at different levers of productivity, such as skills, technology, and they're interested in what was the role of, or potential role of, health and wellbeing in boosting productivity within manufacturing. And I guess we did a number of things. One is we looked at the existing evidence base. We sort of scoured sort of the academic literature. The second thing we did was we ran a survey with EEF members, asking them about their health and wellbeing practices and trying to link those to business outcomes. And the third thing was some case studies, one of which you're going to hear about later on. I guess there are three sort of key messages that I'd like to get across from the presentation today. The first is that there's kind of clear academic evidence that interventions that improve health and wellbeing lead to gains in productivity, and that there are greater returns on investment from preventative interventions. So interventions included within preventative interventions are things that are aimed at changing the social and psychological conditions of work. So things like how much control or say people have over their work, the level of support they receive from colleagues, how supportive their line manager is. The second key message is there appears to be scope for manufacturing organisations to focus on psychological health more and on preventative interventions in both mental health and more generally. The third key message really is that there's lots of resources out there that can help you get started on your health and wellbeing journey, but perhaps the two most important things to do is to understand the kind of health risks in your organisation, how they're patterned, so that you can target resources in line with those needs. And also the second thing, probably to evaluate and kind of learn what is working in your context. So moving on now to talk about the evidence base. We scoured the academic and research literature, focusing explicitly on manufacturing organisations. I guess there are a couple of points worth making. The first is that the numbers do stack up. So we found that investing in health and wellbeing boosts productivity by an average of 10%, but can boost it up to 17%. We also found that there's evidence that the benefits derived outweigh the cost of investment, in particular for preventative interventions. So for example, the Farm Review on mental health interventions found an average return on investment of 4 to 1, but the ROI could be up as high as 9 to 1. The second thing to highlight is there are a host of business benefits for improved health and well-being. So in addition to productivity, greater engagement of staff, greater resilience, so there are a host of other benefits. The third thing to highlight is there is a potential caveat to all of this, is that our analysis of the survey of EEF member practices found that a clear link between health and well-being and business outcomes only could be shown when there were 5 or more practices in place. Where there were less than five practices, no link was demonstrated. And this kind of mirrors other research that's been carried out by independent research institutes. For example, analysis of submissions to Britain's Healthiest Workplace Awards shows a similar threshold effect. So there appears to be something around, having a number of practices in place can help build a culture of well-being, but also that having practices which kind of build on and complement each other is important. It's worth saying that many of the practices we're talking about are kind of inexpensive or in some cases mandated by legislation. So it doesn't have to be the case that the 5 practices will mean that it'll be very expensive for you to launch a health and wellbeing program. So I'm going to move on now to talk about and highlight how the alignment between interventions to improve health and wellbeing and other productivity drivers in manufacturing. Specifically, kind of lean production and process efficiency measures. So the research evidence here suggests that for these methods to work sustainably, the way in which jobs are designed and work is organised are critical. So designing work in a way that gives employees voice in how work is done, greater autonomy to make decisions, and better support from line managers facilitates the achievement of process efficiency outcomes. But these factors, autonomy, voice support, are key conditions of work identified in what we call good quality work and also identified in HSE's stress management standards. So they're important in determining how sort of psychologically healthy work is. So the point is that taking steps to ensure employees have enough voice, support and autonomy can both help implement lean production methods effectively, but also support the health and well-being of your workforce. So now I'm going to hand over to Jenny for a quick poll.
Thanks, Dan. Yes, so for our first poll this morning, we would like you to tell us which of the following areas you are considering as part of your health and wellbeing program. Is it, and you can select all that applies, so is it identifying and managing the physical health risks like MSD, stress and supporting the mental health of the workforce, promoting healthy lifestyle choices, or none of the above? Just give a couple of moments to give everybody a chance to select their answers. Okay, that's great. I think we'll close the poll now and take a look at what the results are. So interestingly there, Dan, majority of people are, so 86% are looking at stress and supporting mental health of the workforce. Second to that is promoting healthy lifestyle choices at 67%, and in third place is identifying and managing the physical health risks. And I think what I think is really good news is there's only 2% of those who are on the webinar this morning who aren't thinking of any of the above. Is that the kind of thing you'd expect to see?
Well, it's interesting results. I mean, it actually sort of contradicts to some extent the survey I'm going to talk about in a moment. It's actually very positive that such a high percentage are taking action to support the mental health of the workforce and promoting healthy lifestyle choices. So yeah, it's very, very positive, but very different to what I'm about to say. So moving on to talk about the survey of EEF members, asking them about their practices. So it seems that from this, from the survey that we did of EEF members, a relatively small percentage of EEF members are taking action to understand how employees perceive the social and psychological conditions of work through stress or psychosocial risk audits or surveys. So you can see here, 14% said they were doing that. So this is a kind of potential missed opportunity, since we've seen that or heard that intervening in preventative measures around psychological health can have huge returns on investment. The second thing to probably point out is that also relatively less people seem to be investing in helping employees, managers or otherwise, to be able to manage their own or others' stress. So you can see here 32% were engaging in stress management training. And I guess the key message that I'd like to get across is that when it comes to intervening to support health and wellbeing in your organisation, the fundamental importance of line managers, they are both critical in shaping the experience of work, but also they have lots of opportunities to intervene. So I think they're a key point of intervention around health and wellbeing. The other interesting thing is relatively less common from the survey results was employers intervening to address modifiable health risk factors through activities such as promotion of healthy eating options, which is 31%, and subsidised gym membership, 32% on the survey. So overall, from our survey, it's seen that EEF members seem to be investing more in physical health compared with mental health, and less in preventative interventions compared with action once a health problem had already risen. So you can see there 54% were investing in rehabilitation support for employees returning to work. So given the high return on investment ratios for preventative work, there seems to be some opportunities for embracing health and wellbeing more in some manufacturing organisations. So moving on now to some tips to get you started on your health and wellbeing programme. This slide is about sort of building the business case in your organisation, in particular getting senior level buy-in. I guess the challenge to you all is to think widely when articulating the business case for health and wellbeing. So don't just think in terms of cost savings from reduced absence, although that is important. Think to what business problems might a healthier workforce be a solution? And there are a multitude of those, from quality and continuity of service, improved staff availability, creativity, agility, engagement. So there's lots of potential benefits from investing in a healthier workforce. So moving on now to some other tips around getting a health and wellbeing program started. The first thing really is, I guess you may already have a wellbeing program in place, but if you don't, a good starting point is to start the conversation by asking some questions about wellbeing at work through focus groups, surveys. That can not only give you a picture of health risks and needs in your organisation and where to target interventions, it's also an intervention itself because it raises awareness of the issues, gets people talking about the issues, and that alone can potentially start to change behaviour. The second point is around accessing existing support. So there's lots of free resources you can draw on. For example, Mates in Mind, Time to Talk, campaigns which can help you to address the way people think about mental health in your organisation and start to change the culture. Align with existing initiatives. So it doesn't always have to be that your health and wellbeing program starts a whole load of new initiatives. It could be that you could build in some health and wellbeing components to existing initiatives. So for example, if you had a leadership development program in place, introducing resilience concepts into that program could be a good way forward. Be joined up, so pay careful attention to process as well as content, so get people's views to ensure they buy in and their ownership with the implementation of any program you put in place. The kind of final point really is around evaluation. Kind of my experience would suggest that few employees evaluate their wellbeing initiatives. And it's a good idea to kind of build evaluation in from the start rather than sort of get some way down the line and then start to think that you need evaluation. If you build it in from the start, you can start to ask yourself questions around what are the key success criteria, what will be different as a result, and think widely in terms of knowledge, attitudes, behaviours. What will you see, hear and feel that will tell you that your initiatives have had impact? Then once you have your success criteria, be sure to sort of follow up at regular points and learn what's kind of working and what's not working and what's changing. Don't just sort of stop at happy sheets, have sort of regular follow-ups. So I guess the sort of summary sort of key points for me are really that firstly, there's clear evidence to support investment in health and wellbeing, clear links with productivity. Invest in preventative interventions if you can, as much as you can, because they have high levels of return on investment. And also there's lots of resources to get you started on your health and wellbeing program, and make sure you build evaluation from the start so that you're sure that you're learning what works best in your organisation. I'm going to hand you back now over to Jenny.
Thanks, Dan. That's great. Some great insight there. If you have any questions for Dan, pop them into the chat box. We'll pick them up at the end in the Q&A session. We'll now pass over to James Brown from Siemens, where we will see how a health and wellbeing programme works in practice.
Thanks very much, Jenny, and good morning, everyone. So I'll try today to focus on the actual initiatives we've put in place within our organisation, but I will just set the business context first. So if we just go on to the first slide, within Siemens UK, we divide our wellbeing programme, which is entitled Healthy at Siemens, into 5 core areas, which are probably familiar to you because most organisations use similar ones. The aim of our programme is to eventually have programmes support events and initiatives in each of those 5 areas, but at the moment we're focusing particularly on emotional well-being and the medical care and assistance side of things. Just moving on to the business case, I'll skim this because Dan's already touched on it, but we're looking at a lot of the key metrics that Dan's already mentioned: reducing sickness absence, improving employee engagement, reducing staff turnover, looking at our employer brand and promoting that, and I think most importantly, just it's the right thing to do for a responsible employer. So I've also got some UK health statistics on that page, which I think demonstrate you don't have to do in-depth surveys of the well-being of your specific population. You can use general UK trends if you're a large enough employer. So I think the main driver that really got our executive management team's attention was our annual engagement survey. We run this every 2 years and the questions are set globally. So in 2015, for the first time, we had quite a few questions around well-being, work-life balance, and the wellbeing programs that our company offers. And while quite a lot of the responses were positive, we did have 2 questions in particular where we got very low responses on the wellbeing side of things, and particularly in the UK compared to our global workforce, which is around the pressure on the job and specifically the company's wellbeing program, and are we doing enough to support employee health? So that really got, I think we were already forming our wellbeing program, but that really got us the ammunition to do a big launch of the program, which was positive from my perspective. You can see from 2017, unfortunately, some of the questions have changed slightly. So I think some of the trends, both positive and negative, are partly a reflection of changing emphasis in some of the questions. But one positive we can definitely take away is if you look to the bottom line that I think a lot more of our employees are now in agreement that the company's doing a lot to encourage them to take care of their health. So hopefully over time we'll see a more concerted positive trend there. So when we launched our program at our annual leadership forum, and one of the slots was on the launch of wellbeing, but particularly focusing on mental health, and we had quite a list of quotes, hard-hitting quotes actually, from the engagement survey around people who are kind of buried under excess pressure, work stress, didn't think they were getting enough support, and we got a really strong reaction from the audience actually there, and it in fact prompted one of our most senior leaders to stand up in the conference and talk about his own experiences with burnout, which I think really set the tone from the top. Got again really good reception in the audience, and really did a huge amount right from the beginning to kind of change the culture of the organisation, destigmatise the topic of mental health. So that was a really positive starting place to come from. So what's in our programme? We focused on 6 key areas. We actually initially focused on 5, and we've just looked at adding a support for remote workers because we feel a lot of our initiatives at the moment, unfortunately, are easier to access for our colleagues at larger sites because we have a very diverse workforce spread across the UK. But what I'll do now is just go through each of those elements in a bit more detail on the coming slides. So firstly, we looked at aligned communication program across all of our divisions. So we have quarterly wellbeing themes, and we use a variety of we have an internal social network, so we put regular posts on there related to our themes. We support them with posters at our sites, podcasts and webinars, and occasionally we manage central events that employees can join. So we did a step challenge last summer that we got really good engagement on. I think the communications was our first step, just to kind of acclimatize people to talking about well-being within the workplace and get everyone on the same page and talking about the topic as a first step to really considering changing their own health behaviours. The second thing we introduced was a network of wellbeing champions. So the feedback we got from our health and safety community who own the wellbeing topic within Siemens is that while they're very much bought into it, they didn't feel they had a huge amount of capacity in their day jobs to really do the topic justice and roll it out within their businesses. So we felt that rather than just forcing extra work on them, we could get willing volunteers to step up, become wellbeing champions. And if they're already passionate in, say, certain types of physical activity or mental health or nutrition, that they would already be the best advocates for the program, and they'd also be a lot more approachable for our employees. So they're a good two-way communication channel between senior management and the workforce, whereas I think maybe the health and safety community, often in management roles, are maybe a bit less approachable for many of our employees. So I've just put a bit about the role of the wellbeing champion there, but everyone did a 2-day training course, and we've now got hundreds of champions across the UK. And they're doing great work actually at a number of our sites, completely doing their own in-house wellbeing programs that they organise, in addition to the central strands of the programme, which I'm talking about, that really target local priorities, which is fantastic. So just going on to health checks, we thought that offering health checks to all employees was a key component of our strategy, just in terms of educating them about their current level of health, baselining it, and really also flag any kind of key health risks that they might be unaware of. So we've deployed health kiosks, such as the one in the picture there, across our larger sites on a permanent basis, and we also have a number travelling around our medium-sized sites on a regular basis to try and put as many of our employees in contact with them as possible. And they do a number of your basic health metrics, but also you can track your progress over time and access a lot of health information on them. We try to supplement them by offering face-to-face health checks with a physiologist that are available to all employees again every 3 years. So that covers the same checks as the health kiosk, but also your blood sugar and cholesterol measurements that can't be done on the kiosk. And there's a bit of time there for a personal health consultation, a bit of a two-way discussion around lifestyle and any health goals you might have. So we thought that's a bit more of an interactive experience and quite supplements the kiosk quite well. And we'll slowly over time begin to build a bit of a picture of the health of our workforce out of that as well. So our mental health strategy was really our big launch priority, and there's 3 core strands to what we've done already. So the first of those is the SMART workshop. So that stands for stress management and resilience training. That's available to all of our managers and employees. It's a half-day course for managers, a slightly shorter course for employees, but it covers most of the same content, which you can see on the right-hand side. And it's really introducing the topic of stress, explaining it, and again explaining some tools to build your own resilience and spot stress in others and support them. So we've had really good feedback from, I think we're now up to about 2,000 people actually have gone through the course, and overwhelmingly positive feedback, which has been great. Going beyond stress and resilience, we launched this year our mental health first aid program. So that's a standard training course governed by Mental Health First Aid England, but available for a number of suppliers. And it's a 2-day training course to become a mental health first aider. And it really gives the people on the training course an overview of a wide range of mental health conditions, a lot of misconceptions around what they are and what they are not, and teaches them how to support colleagues with them, both spotting the initial signs and then having a supportive conversation with them, just seeing how they're feeling, encourage them to seek professional support and support from their local family network as well, if they're not already doing so. So the mental health first aiders are obviously not clinical psychologists or counsellors, so they're not involved in treatment, but they are there just to be a first point of contact and signpost people to treatment where it's appropriate. We've trained about 100 mental health first aiders in our organisation at the moment. We're continuing to train more, and again, from those who have been trained, we've had really good feedback both on the course, but also, I suppose more importantly, of them putting the learning into practice and actually having a lot of good conversations with employees. Finally, we've had an EAP for a long time now, but a couple of years ago, with the launch of our Healthy at Siemens programme, we changed providers and did a bit more in terms of promoting it. So we've put a lot of information in all our policies across our intranet in regular communications to employees. And we also did a number of site visits where we had our relationship managers from the provider come and talk about the service and all of the strands of it, not just the counselling side of things. And as a result of that, we've actually had our engagement with the programme increase fourfold over the past couple of years. So it's a really strong message. Finally, I'll just really briefly touch on musculoskeletal disorder strategy. So we launched that this year as our other core priority, and the two main strands are physiotherapy advice line and body mechanics workshops. So the body mechanics workshops is a half-day workshop with a physiotherapist, again open to all employees, where they do a series of stretches to identify any muscle imbalances or any lacks of mobility that could go on to cause musculoskeletal disorders if left unresolved, and they're actually then given a series of stretches and exercise plans tailored to address those specific imbalances, so that will hopefully prevent any condition arising. And that's supported with equipment to do the stretches at home and supporting videos showing them how to do the stretches correctly. The physiotherapy advice line is sort of a reactive duplicate of that service. So if someone has actually suffered an MSD, they can then call that service in work hours. They'll receive a call back from a physiotherapist within the next couple of days. And again, if appropriate, they'll be given a self-management plan of a series of stretches that they can do at home to reduce the symptoms or hopefully resolve the condition. And then the physiotherapist will call them back over the next couple of weeks just to check that plan is actually working for them or making any corrections. Where face-to-face physio is required, if they've got private medical benefit, they can use that. If not, they can get a corporate rate through our provider or be signposted onto their GP. I won't cover the Bupa Boost app, but a lot of wellbeing suppliers might have a supplementary app that links to various activity trackers, and you can set your own wellbeing challenges up. So that kind of app can be useful for running corporate challenges and engaging people in changing their health behaviour. And finally, what I'd like to quickly touch on is lessons learned. So one challenge that Dan's already alluded to is, I think, the evaluation side of our program is a bit weak at the moment. So we do obviously evaluate employee satisfaction with all of the events they've engaged with. What we haven't been so good at is then looking at the long-term metrics. Are we changing people's long-term health? Are we changing their sickness absence? So that's something we're very much focusing on in the next year or two. The other challenge has been trying to get the program driven locally within each division and business. So we've set up a health management committee with representatives from each division to drive our strategy going forward and really get that buy-in across the organisation and try and have a sponsor within each business that will really drive the program locally. And we've had good results from that over the last year. So that's it from me. Obviously, if you have any questions, feel free to get in touch.
Thanks, James. Really interesting to see how you've got those themes aligned to some of the core areas and the core issues that you found in your workplace. That's really interesting. So thank you very much. Any questions for James? As always, just pop them in the chat box and we put them to him and the other speakers at the end. We've got a few questions coming in, so please do keep them coming through. You'll see a key theme that's came out from our report. Also, the poll we ran earlier on, and certainly James's discussion as well, is the importance of mental health, the mental health of the workforce. And so I'm now pleased to pass over to Richard Holmes from Westfield Health, who's going to take a closer look at this important area.
Thank you, Jenny, and good morning, everyone. I'm not sure whether you're aware, but the latest research from the CIPD suggests that over the past year, a third of organisations have reported an increase in stress-related absence. So it's really high on the agenda. How can you then support the performance of your people and your business? I'm going to talk to you about the relationship between pressure and performance, the challenge and opportunity available to you, and then we'll bring it all together into a whole of workforce solution. The key here is the difference between pressure and stress. Two phrases we tend incorrectly to use interchangeably to mean the same thing. Now, pressure in life is inevitable. How we react to pressure can make the difference between good and bad outcomes. If we believe we can manage a situation effectively, we perform well. But if we perceive that we can't cope with the pressure that we're confronted with, then that situation becomes stressful. Stress is simply a negative outcome to a situation that we believe we can't cope with. Being under pressure is important. It's the spur we need to do things well. So let's look at the relationship between pressure and performance in a little bit more detail. This diagram shows the relationship between pressure and performance, whether that's at work, at home, or in your relationships. Now, we spend most of our time living under what we see as normal levels of pressure. This is when we're in what we call our comfort zones. You've probably heard the phrase, he or she was too comfortable, or he or she was complacent, when explaining why someone's underperformed. And if you look at the left half of the comfort zone, you can see how our level of performance declines as the level of pressure drops. Pressure is extremely important. Pressure provides the stimulus for us to perform well. And when the pressure increases and we step out of our comfort zone, we tend to perform at our best. We're in what's called our stretch zone. Here, the level of pressure is quite intense. Check out how high the level of pressure needs to be for us to perform at our peak. However, the common problem is that a lot of us think we can keep stretching and stretching ourselves, but this just isn't the case. Eventually, the pressure gets too much. We perceive we cannot cope as well, and we slip into what we call the strain zone. Now, this is when things become or start to become stressful. We start to get tired. Our judgment isn't quite as good as it usually is, and we start to make mistakes. I'm sure you recognize some of those things. And as you can imagine, our performance then starts to suffer. So if the pressure keeps piling on without let up, we'll eventually drop into the red zone and our performance levels will plummet. And if you stay in this zone for an extended period of time, there's a high risk of exhaustion culminating in burnout. And quite often, this is the zone people are in when they're considered to be suffering from anxiety and depression. Now, the charity Mind suggests that 1 in 4 people in the UK experiences mental health problems each year. That's 25% of your employees, potentially in the strain and red zone. Significantly, they'll be underperforming at work as a result. So let me ask you a couple of rhetorical questions to think about. As an individual, where are you personally at the moment on this pressure performance curve? How do you know when you've been stretched too far? What do you do about it? Do you have a tendency to just keep plugging away with your performance steadily declining? Or do you have a way of escaping back into your comfort zone to refresh, regroup, and refocus before jumping back into the fray to deal with the situation you face? Now, some of us are naturally resilient and do these things by instinct. Most of us need training to become more resilient to pressure. Jenny, next slide. So this slide shows what can typically be achieved by training people to become more resilient. It's an example of the outcomes from an employee resilience workshop program, or a typical one. So coping better with pressure, or becoming more resilient to pressure, is a learned skill. Enlightened organizations recognize 2 things. Firstly, their people's performance, and subsequently that of their organization, is directly related to how well their people are able to handle pressure. And secondly, as such, resilience training is a fundamental part of their training for both personal and professional development. Now, when we deliver resilience training programs, we evaluate impact in terms of both behavior change and the subsequent change in levels of engagement and resilience. And as Dan mentioned, it's critical that you evaluate the impact of your interventions to understand what's working and to get an understanding of the return you're achieving from your training investment. So what is the most common mistake organizations make when developing resilience programs? So take a look at the stats on the left-hand side of this slide. One of the key determinants of work-related stress is the culture within an organisation. Most common mistake organisations make when developing stress and resilience training programs is that they focus just on the employees. All the research demonstrates that the culture of the organisation is critical. We can put all the individual training in place, but if individuals don't feel they have permission to deploy those recommended coping strategies that we train, or if they feel that the training is in place just so that they can be driven even harder, then that training becomes less effective in terms of developing behaviour change and enhanced performance. To develop a culture that's supportive of and conducive to good mental health, you need to start from the top. You develop a resilient organisation by senior leadership driving a supportive culture, allowing line managers to develop practices to foster team resilience, which in turn allowing individual employees to engage in more resilient behaviours. So where are you compared to other organisations in the UK in relation to developing a mental health strategy? Now, the research from our academic partners at the Advanced Wellbeing Research Centre at Sheffield Hallam University, as well as the wider research community touched on by Dan, demonstrates that organisations who proactively manage resilience perform better in a number of key performance business indicators. So where are you compared to the rest of the UK organisations in terms of developing a mental health strategy to improve business performance? Can we just go back again, Jenny? Thank you. Are you one of the 16% with a defined strategy? One of the 37% looking to implement one in the next 12 months? Or is this a longer term goal for you? In terms of implementing a mental health strategy, what types of programs and interventions should you be looking to implement? Now, the previous presentation from James showed how Siemens have developed a balanced approach to mental health, supporting those at risk, as well as preventative programs to prevent poor mental health developing in the first place. And as Dan mentioned earlier, programs currently tend to focus on reacting to problems. That is, delivering risk management services designed to support employees with a problem. They focus on services such as mental health first aid training and employee assistance programs. However, these are a critical component of any mental health program. We have to support those employees at risk. And these services are an essential part of the solution, just not the whole of the solution. To develop an effective program that drives business performance, we need a whole of workforce solution focused on driving behaviour change. To drive this behaviour change, we need to first get people engaged, and then once engaged, have in place programs targeted at performance. A whole of workforce solution needs to deliver interventions targeting the whole of the business. That's employees, managers, and senior leaders. Okay, thank you for listening. Hopefully we've provided some useful insights into how taking a whole of workforce approach can directly impact on the performance of your people and consequently the performance of your business. If you do want to know more, then please feel free to contact Westfield Health directly. Before we finish, we're going to run the last poll question, so I'll now hand you back to Jenny. Jenny?
Thanks, Richard. Yes, so I'd like to take you through our final poll for the morning. And we would like you to tell us, so this is to just select one answer, where is your organisation in terms of developing a mental health strategy? Do you have a defined strategy and programme in place? Are you looking to develop one in the next 12 months? Is it likely that you'll develop one in the next 2 to 3 years? Or you don't foresee developing one in any of those time frames? Again, I'll just give a few moments so everyone has a chance to consider the question and submit their answer. That's great. Thank you very much. We'll close the poll now and take a look at what the results are. So Richard, quite interesting. Just 10% currently have a defined strategy and program in place. 51% looking to do one in the next 12 months, and then a further 30 looking maybe in the next 2 to 3 years, and just 9% not thinking in any of those timeframes at this point. Is that the kind of response you'd expect to see?
Yes, Jenny, and actually it closely mirrors the stats that we mentioned in the presentation, except sort of slightly better. So whilst you've got less with a defined strategy in place at the moment, 10% compared to 16, we've actually got more within this group actually looking to implement in the next 12 months, 51% versus 30%, 37% as a national average. Most importantly, only 9% not foreseeing doing anything, whereas in the national survey, that was around 21%. So that probably reflects back to the poll that Dan did, where he was asking about considering what you would use in your health and wellbeing program, and we got a significant proportion, 86%, suggesting that they would be building in stress and mental health services. So that sort of ties in with the pattern of those looking to develop a program in 12 months. So really encouraging from the EEF members in terms of the focus that's going to be taking place in this. I think the key message for me is that's great that you're doing something, great that you're looking to doing something. Be very careful about the content that you put in, that you actually focus on putting preventative programs in place to support good mental health, as well as risk management programs to support people with poor mental health.
Great, thank you very much, Richard. Yes, there is certainly a theme with the audience we have here that's really positive in the way of supporting mental health in the workplace. So we do have a few minutes remaining to pick up some of the questions. So a lot of the questions come in have been around providers for some of the services, and certainly those that you talk through, James. So around the mental health first aiders and your training for your wellbeing champions, and the SMART training as well. Could you just give a very brief overview of the kind of considerations you made and how you went about sourcing those providers?
Right, yeah, I'm not sure whether, like the BBC, I'm limited in kind of pitching for providers here, but for our EAP, we did a comprehensive market review, and the same for our stress management training. For the mental health first aid provision, it's interesting because, as I think I mentioned, the Mental Health First Aid England are the organisation that licensed the training. So whoever you go for that, they will be running exactly the same course that's licensed by Mental Health First Aid England. So in that case, we actually just pretty much made a commercial decision that the provider we already used, our EAP provider, in fact, who you can probably work out from our slides, was who we got to deliver that, and we've had good results from them. But for the stress management and resilience training, there were a number of organisations who offer that, and quite a number who I thought from our market review would offer a very very good service. So I'm happy to give people specific notes if they're of interest. I probably shouldn't be pitching that on the call, but there are a number of providers out there that I think can offer good services in that area as well.
Great, thanks. Richard, I know you offer a number of services around these areas. Any tips for our audience on how you select a provider?
Well, it's a little bit of a biased question. I'll be upfront. As the EEF's exclusive partner for the provision of health and wellbeing services to the members, obviously the services shown on the slide that categorise as sort of risk management, prevention, engagement are all services that we provide on a sort of discounted basis to EEF members. But yeah, it's always sensible that you make sure that you review your provision properly and effectively to make sure that you're not only getting best value for money, but strategically you've got the right provider or providers that enable you to deliver the program that you're trying to do. One of the areas we've looked at is making sure that we can support an organisation both in engagement, performance and risk management, so that we can provide sort of a strategic approach to designing solutions bespoke to each individual organisation.
One more thing I would say, sorry, just on the EAP provision, is it's one thing that I think is really valuable is get a provider that's willing to show you, obviously at an anonymised aggregated level, the positive effects their counselling has on the people using the service. So you really have that confidence that people are getting the support they need from the service without obviously having individual data there.
Great.
Couldn't agree more with James's comments. It's absolutely critical, as sort of I emphasise, that your providers are able to provide feedback so that you can actually evaluate what's working, what's not working, and demonstrate the impact that your programs are having or are not having, so that you can keep focusing them and changing them on an ongoing basis.
Thanks. That's great. Thank you both. That's actually all we have time for in terms of questions. So a lot of the other questions that come in now, some pretty broad themes and similar questions coming in. A lot of it relating to either the survey or to the Siemens case study. The report that we produced, Unlocking Employee Wellbeing, covers both of those and more in greater detail. So there's 4 case studies included in that. And there's a write-up of the Siemens story. So when I issue a follow-up email to this webinar, I'll send you that report as well, so you can read through that in greater detail. And a recording of the webinar will also be issued to those asking if they can get the slides or recording to share with their HR colleagues. Then yes, it should be available in the next 24 to 48 hours. Everyone who registered will receive an email. Thanks once more to all of our speakers. Thank you. We hope that's been a valuable session for you. So thank you to our partner, Westfield Health. Westfield Health are an award-winning health and wellbeing provider who provide support to businesses to build a health and wellbeing strategy that's based on insight-led interventions. They are committed to helping people lead healthier, happier lives, supporting them with everything from sleep to mental health. You can find out more about how they can help you by visiting westfieldhealth.com/business, and you can get in touch by emailing wellbeings@westfieldhealth.com. Thank you also to the Institute for Employment Studies for all the hard work that Dan and the team over there did in the research. IES is an independent research consultancy focused on helping clients in the private, public and third sectors make sustainable improvements in employment and HR policy and practice. And enable both the performance and well-being of employees. And you can find out more at www.employment-studies.co.uk. And if you are looking at the health and wellbeing strategy for your business, we do have a range of support provided by our experts at EEF, including wellbeing vision sessions, wellbeing surveys, through to identifying mental health and physical health risks. If you want to talk to us about how we can help, or if you want to talk to Westfield Health about how they can help you in these areas, there's an option to select that at the end of in the survey at the end of the webinar. We are looking to expand on our surveys and expand on the work that we do with Westfield Health, and so we've included some additional questions in the survey at the end, and we'd be very grateful if you complete these so we can get a clearer picture of the kind of support that you will help you most in this area. So thanks again for joining us today. Thank you to our speakers and our partner, Westfield Health. My contact details and others of the speakers are on the screen. Should you wish or need to get any more information, then please do get in touch. Once again, thank you for your time this morning. We hope to see you again soon.